Hey guys, this is Dr. Tolentino. I'm going to give you all a few minutes to log on to Periscope. It's a little early, like a minute or two, so more or less I'm just going to wait a little while we get a few more people on. I had some technical difficulties last Wednesday when I tried to run Periscope, so for some reason I should have been checking more closely. I thought I actually had it going for at least 2 or 3 more minutes longer than I did, and unfortunately it wasn't the case. If you are able to hear me, please make sure you comment that you are able to do so that if I need to speak up or if I need to adjust the volume or restart the Periscope, we'll do that right away. Progesterone is a very, very important topic. I've had at least 3 or 4 women patients today that came in that had some questions about progesterone, so I'm glad to be talking to you guys about it today. Normally, I've addressed other organs and other hormones and vitamins and basic wellness tips in the past. I think progesterone is actually a topic that everyone can learn about, especially women. It is actually made by both men and women, but in men it's in much smaller quantities. As far as hormones go and replacement go, we don't talk too much about progesterone replacing it in men. It's really not as studied, I guess you'd say, as far as hormone education goes. Yes, there are some hormone doctors that do talk about progesterone in men, even though it is made and it is a precursor to sex hormones, but it's just discussed in smaller quantities. It's also not very well researched, so it's important as far as this discussion goes for it to be more female related. Progesterone. So hormone-wise, I've discussed estrogen, I've discussed testosterone to you guys in the past. It basically is a hormone that all women need, regardless of age. And we generally don't realize that. You don't realize that it's important for every age, whether you're premenopausal, whether you're a teenager, whether you're close to menopause, whether you've had a hysterectomy, and they've removed your uterus, or they've actually removed not just the uterus but the ovaries. It's very important for all women. So no woman should actually be without progesterone. Progesterone's made by our female. So it's also made by the ovaries for women, also made by the adrenal glands, and in women that get pregnant, it's also made by the placenta. It helps women carry the baby through pregnancy. So I did have a patient ask about that, and OBGYN physicians, sometimes for some women, they often prescribe progesterone during pregnancy to help carry the baby. So that's something that a lot of women might relate to. If they've ever been pregnant, then that's probably something that the OBGYN doctors will discuss with you as far as pregnancy goes. So, like I said, it's important for all women. Now, as you age, and as we've gone through the aging process before, the hormones don't become balanced. They actually become less balanced. You have less hormones as you age. So progesterone is definitely a topic that you should bring up, if your levels are concerning or if you start to have symptoms of low progesterone. The types of symptoms that some women get, and I'm sure everybody out there can relate to, as you lose progesterone: symptoms of anxiety and depression, irritability. A lot of people start to develop that. Mood swings, insomnia, having trouble sleeping. Also, increased inflammation and pain. We've talked about inflammation being a marker for other things. Increase in osteoporosis and excessive bleeding risks for women. So if you have heavy periods, painful periods, those types of things, that's very important. Also with the premenstrual type symptoms like the migraine headaches and the severe cramping, that's definitely important too. So, and I just want to make sure that you guys can hear me as I go through this Periscope. So if there's any issues with being able to see or hear me, make sure that you speak up so that I can keep going. Another thing, so I talked about that. Also, weight gain. Surprisingly enough, progesterone, as you lose it, you can also have weight gain or develop weight gain from that. Also, decreased libidos, and of course, cholesterol, decreased HDL cholesterol and problems from there. Some people are actually causing their own bodies, or women are causing their own bodies to have low progesterone levels, high stress, taking antidepressant medications, birth control pills, high sugar diets. We talk about sugar as being one of the biggest markers, one of the biggest killers, especially here in the US. So high sugar, high saturated fat intake. Also, if your other hormones aren't functioning well, like your thyroid, that's another huge one. If your thyroid isn't functioning well, yes, it's affecting the levels of the other hormones, including the sex hormones, like progesterone. Vitamins, so if you have deficiencies in specific vitamins, vitamin A, vitamin B6 is also common, zinc deficiencies, and vitamin C. If you have low levels of those basic vitamins, it's going to cause progesterone to be low in your body. A major thing for you guys to know is to differentiate between natural progesterone, which is plant-based. It can be compounded. There are some available through, from a prescription from your pharmacy. Between natural progesterone and progestins. Progestins are synthetically modified progesterones. They're not quite identical to what your body's actually making, and they can actually be quite harmful. Instead of causing you to have the good benefits, I guess you'd say, of having progesterone in your body, it causes the opposite. So having or taking progestins and not progesterone, natural progesterone, causes the opposite types of symptoms. So you do have, appetite increase, you will have weight gain, you will have some fluid retention. Yes, you're going to still have some irritability and depression, but it does cause a lot of bloating and a lot of breast tenderness. So if you're taking something that's not a natural progesterone, it does have some side effects that actually have the opposite effect. Also acne, hair loss, nausea, trouble sleeping is still there, but it does interfere with your body's own production of progesterone, so that's important. Also, those progestins or progestogens, like I've heard them called, it does interfere not just with your own progesterone, but also with your body's own natural ability to balance out estrogen and progesterone. So it's very important to know that there is a difference between natural progesterone that your body produces or that you would take through bioidentical type of plant-based progesterone and progestins. So that's also a very, very important thing for you to know. It has a ton of feel-good benefits. So progesterone, we know that it's important for a number of things. It's not just important for us to balance, but also it's very important for us to carry the baby through pregnancy, and it's very important during our periods in order to help keep our menstrual cycles regulated. So progesterone levels are often checked by doctors like myself that really are paying attention to the hormones and see where the imbalances are. When you're actually checking the levels, we usually check it when it's at the highest point, or what would potentially be the highest point for women that are still menstruating. It's used pretty much from premenstrual and forward for women that are, I guess you'd say, having irregular periods all the way up to no periods. So all the way through menopause and beyond, women can use natural progesterone. It's very, very safe. Women that have had hysterectomies have a tendency to have very low progesterone levels, so that's something that they should discuss with their doctors. So whether you've had a hysterectomy or not, natural progesterone is really something that's very beneficial for you. You do have progesterone receptors in the breast and in the uterus. You also have progesterone receptors in other areas of the body that cause it to be very important. So it does have the protective benefits of protecting certain areas from cancer and so forth. So I don't want to confuse you between progesterone that's natural and the progestins. So the progestins are the type that cause an increase in cancers, cardiovascular disease, and so forth. But natural progesterone is very safe for women. Now, if you start to develop like premenstrual type symptoms, like the migraine headaches and the cramps, and you see a hormone doctor like myself, there's a few things to do. It's not just a matter of checking the levels. Also, the natural progesterone that I prescribe, it's in different forms. So progesterone, if you're going to prescribe it for symptoms of, progesterone loss or the types of symptoms I mentioned previously, it's important to talk to your doctor about that because it's dosed very differently for different reasons. So depending on what you're coming in for, what the symptoms are, and how your levels are, where you are as far as your medical history, there's a ton of things that come into play as far as how much progesterone that you'll be needing for your body and the purposes of what you're using it for. It's usually used in a lot of higher dosages during certain times of the month for women that are menstruating that are using it for like premenstrual type symptoms. There's more regulated dosages. Usually compounding pharmacies can dose it based on the patient's sensitivity as well. I have some women that are very sensitive to progesterone and they may not need, highest dosages in order to help protect them, help get their levels up and have the benefits of it. I do have other women that require very, very large doses of progesterone to help with a lot of their symptoms. So that's another thing that's important for you to realize. Oral progesterone, when you talk to your doctor about it, there's different ways. You can use the oral type. There's also cream-based. That's also for different reasons. So again, something to discuss. Now, when I was looking at progesterone in men, it is part of the steroidogenesis pathway that we find in our adrenal glands. However, even though it's not discussed so much, the research that I had shown, basically it was that between men and women, yes, men produce it. They produce it in far less quantities, but the problem is that it's not well studied as far as men taking progesterone. So in my office, I don't prescribe too much progesterone. I don't prescribe any progesterone to men at all, actually. So that's not one thing that I do. But I have heard of other hormone physicians that do prescribe progesterone for men. So let's just make that clear. So as far as progesterone goes, in the second half of our menstrual cycles, usually that's when the progesterone levels go up. That's usually the time that's best to check it for a menstruating woman. If you're having difficulties with your periods, if you have heavy bleeding, like the irritability or even issues with the weight, issues before your periods start, like the premenstrual type symptoms and the cramps and the headaches and so forth, and the insomnia, make sure that you talk to myself or somebody else that's, well versed in hormones and understands the balance. I've said this many times before, how all of the hormones are almost like a symphony, and each hormone plays a different instrument. And in order for you to feel your best, for you to look your best, it's important to address all of the hormones. And progesterone is definitely one of those hormones that all women should not be without. So if your levels happen to be low, make sure that you discuss it with your doctor, and they can talk to you about, the different types of hormone replacement and some things that you can do for yourself, like enhancing the other organs. Like, for example, if you start to enhance your thyroid functioning, you start to take some different types of supplements and your doctor educates you on that. There's ways to help improve that. The vitamin deficiencies that I've mentioned are very important for progesterone, so it's definitely something to discuss with your doctor if you think you may have deficiencies of progesterone or hormonal imbalance in general. If you have any direct questions, feel free, discuss with your doctor. You can always email me at jt@elitehealth.com. That's my email address here at the office. Also, you can email info@elitehealth.com if you are interested in learning more about hormones in general, if you want to see me as a patient. I can also provide you with the symptom sheet that I had in previous lectures. So if you're interested in that as well, that's one thing that, feel free to email me about. I will be discussing a new topic next Wednesday, and I also have an upcoming lecture here in the office on memory loss. So I'll probably want to do a Periscope just on memory loss so that we can discuss that further. If you have any more questions or comments, feel free to email me, and I will see you next Wednesday. Have a great day.